Have you walked into a pharmacy and unknowingly make the pharmacy want to pull their hair out? If you're a man watching this video, don't worry. This is not a way to embarrass you. This is not a video to embarrass you. No, no. This video is to help you avoid common mistakes that can make your treatment to be delayed, waste your money, or even put your health at risk. As a pharmacist, I have problem with this kind of people, this kind of men. Men, in quote, can be female, can also be a male. As a pharmacist, I have issues with this kind of men. And you don't want to stop this video halfway. Watch to the end to know these 10 kinds of men that give pharmacists headache. I know it might sound funny, but that is just the truth. Let's get into this video immediately. Let's see if you recognize yourself or someone you know. And if you're a pharmacist or a health professional watching this video, put into the comment section your experience with this kind of men I'm about to list. Number 1 in this category is the I know more than pharmacist man. The I know more than the pharmacist man. So this man has already diagnosed himself using YouTube, Google, or ChatGPT, as the case may be, before coming to the pharmacy. So he walks in asking for a specific, medication without listening to any further advice from the pharmacist or from the doctor or from the health professional, as the case may be. The issue is that the internet can give a general information concerning a particular disease or ailment. Internet can even diagnose you when you slot in or type in your symptoms and all of that. But they don't know your medical history. Even if you type in your medical history, they don't know everything about you. So basing your diagnosis and your medication just on through Google and all kinds of browsing sites is not enough. So Google don't know other medicines you are taking, your allergies, and so on and so forth. And sometimes the medicine you think you need because you're able to see through YouTube, or if some people see through TikTok and all of that, sometimes the medicine you think you need might worsen your case. Yes, might worsen your case. Number 2 kind of men that give pharmacists headache happen to be they give me the strongest drug men. We just walk in. Good afternoon, sir. Please, can you give me the strongest antibiotics you have here? You'll be wondering, okay, sir, sorry, what is happening to you? Why do you need antibiotics? I just feel like I need it. Just give me the strongest one. That is not good, and that is not acceptable in our practice. And so this kind of men give pharmacists and every other health professional's headache. And in most cases, this man wants to treat a viral infection with antibiotics. Maybe he thinks that what is bedeviling him is a bacterial infection. Meanwhile, it's a viral infection. That is why you need to open up to your pharmacist, open up to your doctors, so that they can be able to recommend and prescribe the right medication for your case. Don't just come in and request, for one strongest antibiotics or one strongest antiviral drug or one strongest antifungal drug, and we don't know the reason, we don't know why you are requesting for it. No. And some of these people, they don't allow us to talk, They want us to do their bidding because they have money to pay, which is wrong. Number 3 kinds of men that give pharmacists headache are I stop taking my medication because I feel better, man. You give them, they are on antibiotics, they're supposed to run for 5 days or for 7 days, and they stop taking it on the 2nd or the 3rd day because they feel better. If you ask them, they say, well, I don't see any need of taking it because I'm fine, I'm better, I'm okay. This kind of men give pharmacists headache because when the bacterial infection occurs, they will say, you give me drug and the drug did not work. I took it, I was better, and after some time, the thing came back. These are the kind of men that disturb us. I tell you the truth. It may be funny, but if you are part of this men, repent today. Turn a new leaf. Number 4 kind of men that disturb or cause pharmacists headache happen to be I don't read instructions man. They don't check whether the drug or the medication need to be taken without food. They don't check how many tablet or capsules they are supposed to take. What is the dosage of this medication? They just come, buy, and they leave. Because they already have a preconceived dosage in their mind for the medication they want to buy. So they don't want to get any instruction from you as a pharmacist and all of that. This kind of men give us headache. I tell you the truth. Number 5 kinds of men that give pharmacists headache are my friend use it, I will use it too, man. These are the kind of people that you can see as a pharmacist patronizing your pharmacy where you are currently practicing. His neighbor or his friend or his colleague has similar symptoms that he is experiencing and took the particular medication that he wants to buy, and the medication works for his friend, works for his neighbor, works for his brother or his sister, and he comes straight to the pharmacy and says, I want to buy this medication because my friend, it worked for my friend and I believe it will work for me. And when the pharmacist wants to come in, say, no, don't worry. Because the drug that works for your friend may not work for you. Because your body system is not the same system with your friend. and with your colleague or with your brother, with your sister. And your symptom might be similar, but it might not be the same disease or might not be the same infection that your friend experienced. So people have different medication conditions. People have different allergies, the age difference, weight difference, and differences in body responses to medication. So these are the things the pharmacist considers before recommending the medication to you or approving the ones you want to buy. Number 6 kind of men that give pharmacist headache are the everything is malaria kind of man. I feel headache, I think it's malaria. I feel tired, I think it's malaria. I feel like my tongue is bitter, I think it's malaria. And I feel this way, I think it's malaria. Pharmacy, please give me malaria drug. I think I'm having symptoms of malaria. And when you try to probe further to know more, they don't want to give you, they don't want to listen. Just don't worry, just give me malaria drug and give me paracetamol, let me go. I know I have malaria. This kind of man often gives off headache. The number 7 kind of men that give pharmacists headache are the kind of men, the kind that want medications without answering any of your questions. These ones are very stubborn. These ones are very angry. They believe that as a pharmacist, you don't know what you are doing. Whatever you recommend, whatever you say does not count. So you do their bidding or they walk away, which is a very bad attitude, especially when it is related to your health. So when the pharmacists want to ask some questions, they don't give that allowance. As the pharmacist, I can tell you that some of the questions we ask are for your own good. They minimize the probability of your medication interacting with each other. They minimize the probability of you having some major side effects that should have been avoided. And it goes a long way to help you recover quickly because the pharmacists have your best at heart and wants to give you the best. My 8 kind of men that give pharmacists headache are the I hide important information kind of men. Yes. They will not remember to tell you that they are diabetic, they are on diabetic drugs. They will not remember to tell you that they are ulcer patients. They will not remember to tell you whether they have a kidney disease or liver issue and all of that. That is why most of the patients I meet, I ask them, do you have ulcer? Are you an ulcer patient? So from their reply, I will know the NSAIDs to recommend or the drugs to recommend for them that will help them in the case at hand. Or some will not remember, some we have to ask them, that is why we pharmacists ask questions, because most times the answer we get don't normally come without us asking, and those answers helps us make a good decision at the end that will benefit the patient. So this kind of men, they don't want to disclose their medical history to you so that you will know the issue on how to come in their situation or their condition. Number 9 kinds of men that give pharmacists headache are the I miss alcohol withdrawals kind of men. The I miss alcohol withdrawals kind of men. Listen, mixing alcohol with your drugs can either reduce the effectiveness of the drug or increase the side effect of the drug, especially if the drug have the probability of making you weak, drowsy, dizzy, having nausea kind of feelings, like vomiting, feeling sickly, and all of that. So alcohol can exacerbate the side effect, which is why you must not or you should not mix your drug with alcohol. But this kind of men will not accept. I have met a patient, you tell him, don't take it's okay, but I can take it after. Say, I can take this one in the morning now, then in the evening I will take, I don't take, that kind of, I don't take too much, just 1 bottle, 2 bottles, with 2 bottles. They'll be asking you questions upon questions. Young man, if you want to get better, don't mix your drugs with alcohol. This kind of men give us a headache. But I believe after you have seen this video, that you will change. Put it in the comment section that I have changed. I believe you. Number 10 kind of men that give pharmacists headache are the I only visit the pharmacy when their condition gets serious. This kind of men, they ignore symptoms for weeks. They say they manage, some even manage their condition with abo, traditional medicines and all of that. They are getting worse, they are still taking it, and when the situation have gotten, this kind of people, many pharmacists don't have any choice. Please go to the hospital for the doctor to attend to you. At this level, we can't do much or we can't do anything. So you need the doctor's attention at this kind of level. And they are being recommended to the hospital for proper checkup because many things might have gone wrong. Pharmacists are no magicians. See the pharmacist, and the pharmacist will know where he or she can come in. If he or she knows that your condition is critical, recommend you quickly, refer you to see a doctor or to go to the hospital for proper medication and proper checkup. I have done that. Someone chatted me up, see the case. I said, please take her to the hospital. This case is not what we handle in the pharmacy and all of that. So this kind of men are part of the kind of men that give pharmacists headache. They come and they expect you to perform magic. I believe that this video is meeting you well. Final thought before I leave you in this video: pharmacists are not just drug sellers and drug dispensers, as the case may be. We are trained professionals whose job is to help you use your medication safely and effectively. Working together with your pharmacist can save you money, prevent complications, and even save your life. The key news is that every man or every woman with this kind of habit can change today. Yes, you can change today. Before I leave in this video, please like, share this video, subscribe, put on the notification button, and comment the number that reveals who you are. Comment it, put it in the comment section. Until I come your way next time, I remain your pharmacist, Ezekiel Ozomba. Thank you for watching.